Hi. Uh, Thank you so much for joining us today. So, we have with us Sen and Peter, and Reena has recently joined us. So, let us introduce ourselves. So, my name is Apurv. I have been a volunteer with CDS Kenya for the last 3 years, wherein I mostly help with technology and social media. Can you introduce yourself, Sen, and then we can move on to Peter?
Yeah, sure. Yeah, hi, my name is Zain, and I have been a volunteer with CTS Kenya for, I guess, 2 months. And I have been holding the position of fundraising advisor till then.
Got it. Peter, could you introduce yourself?
Okay, this is Peter Chem, the founder and executive director for CDS since 2009 up to now. So welcome and feel free. Thank you.
Thank you. So, Peter, could you tell us about the team? How big is the team currently, and how many members are involved?
You need to say.
Yes. So, can you tell us, like, how big is the CDS team right now? Like, you have two offices in Kenya and US. Like, how big is the team? Can you tell us a little bit more about that?
Okay, currently CDS started in 2009 as a Kenyan organization, but with the time it moved now to become an international organization. Now has another office in the US, whereby now we have two full-time workers in Kenya, and US we haven't established a full-time workers because it's still new in the US, but we have volunteers globally that assist our programs. So we engage volunteers based on activity basis. If we have a program to run, that's how we do. So currently we are supporting some students in schools who now opened, others open today, others tomorrow, around 18 students currently, but we have been supporting around 22, but others have graduated, others are ongoing with education. Then we have other programs on health. We support health programs, water, environment, and agriculture. So that's our major programs.
Wow, that's a lot. So, you mentioned education, you mentioned health, you mentioned agriculture. Those are a lot of programs. Nice. And you mentioned in education, you're sponsoring 22 uh, students. And they have some have graduated as well. How many students have graduated, Peter?
4.
4 students have graduated. Wow, that's really nice.
Yes.
And usually, how many new students will be coming in this year?
Those are there are 18, but also they are graduating this year around 2 again. They are doing their last exams also December this year.
Okay,
so there are 18. Yeah.
18 students would be there this year. 2 would be graduating.
2 this year again.
Got it. So 18 new students would be joining this year. Is that correct?
You are saying?
So 18 new students would be joining this year. Is that correct?
Yes, yes.
Got it. And so what would that take the total strength to?
In terms of, we pay their fees and other modalities, but it costs us around 1 million Kenyan money, which is around 1,000, around 100,000 US dollars for the academic year.
Got it. And how do you plan to raise this money? How do you plan to?
We are doing it on the, like what we are doing, like we are doing publicity on making appeals to friends, to organization, raising proposal so that we can support the program. So far we have only raised 500 US dollars, so which is very little money, and we need around 100,000 US dollars. So yeah.
Got it. Great. So Reena has joined us. Reena, would you like to introduce yourself?
Hi, I joined CDS Kenya in 2019 as a UN volunteer with the wages program. And then I am now in the position of board member for in charge of the wages program and also involved in the community hospital. So
Oh, that's interesting, Rina. So could you tell us a little bit more about the wages program? How did it start? How has it been going?
The wages program started when the pandemic hit. There were a lot of women and girls specifically in the Cheptais region in Kenya that were unable to attend school. So this scholarship program was designed to bridge those gaps and in a sustainable way. So with an emphasis on empowerment and employment and teaching women employability skills that would allow them to partner with students in the wages who are wages beneficiaries as well. Unfortunately, a lot of our targets we've had difficulty reaching our targets because of financial constraints. So that's where this is a really important work that we're doing. So it's important to get those funds because we want to have more students graduating from these programs instead of having to put their education on hold because we're unable to send funds to schools. And so there's a bit of an issue there, but it's a really fantastic program, being able to keep in contact with the students and see the longevity of once they graduate, that they're in the workforce, and keeping in contact with them to keep them motivated and allowing them opportunities for like shadowing in other professions and be sort of internships or co-ops. That's really important as well. So building these relationships and maintaining them is very important to us.
God, and have you interacted with these students one-on-one?
Just through video. I haven't been to Kenya yet myself, unfortunately, but with Peter as the liaison for a lot of this work, it's been online content that we've generated, which is because it's international, and with COVID restrictions for travel and things like that, depending on where you live, it's a little harder. It's slowly opening up, but it's a little harder to do that.
God, could you tell us a little bit more about the healthcare project you were mentioning as well?
Sure, yeah. So we have been looking at building a new community hospital because in this specific region of Cheptais, there is not like the closest, there aren't as many facilities for healthcare and healthcare maintenance, and also for emergency services. So we're looking at blueprints, or like generating. We've purchased a plot of land and a building, but it's now a matter of making that building tailored to the needs of the community. So there has been like an initial survey conducted about I think the past summer, summer of 2021 or 2022. I can't remember right now. I think it was 2022, where we took an inventory of the medical facilities in the region, the medical tools, for like common illnesses and diseases, what would need to be treated, what kind of doctors and medical professionals we would need, and then also incorporating the wages program into that, so that way students who are interested in healthcare can also have access to training at this facility, and it would be a community hospital, so that way it has some kind of sustainability and doesn't, and can be internally reliable, like there can be some internal accountability within Cheptais and within the communities in that area, so that they can be self-sufficient, with also partnerships internationally.
God. Well, thank you so much, Rina, for that explanation. would just like to show some of the links how people can contribute to the cause. So if so people can go on GoFundMe or PayPal or Venmo and donate to the cause. So thank you so much, everyone, for joining. Thank you so very much. And we would really like if you could contribute to the cause. Thank you once again. Bye.